My name is Mauro-Small, and I am the site director for the Pediatric Inpatient Hospitalist Program here at Signature Healthcare. I'm also the Chief of Pediatrics here at Signature Healthcare. The Pediatric Inpatient Hospitalist Program is a joint venture between Tufts Floating Hospital for Children and Signature Healthcare. So as a pediatric hospitalist, the conditions that we most often take care of on the pediatric unit would be dehydration from stomach bugs, respiratory illnesses, whether it's an asthma exacerbation, bronchiolitis, pneumonia, things like that. The benefit of having a pediatric hospitalist at Signature Healthcare is that it allows pediatric patients that are ill to stay here in the community, close to their families, as opposed to having to go into Boston. We can meet with the family at different times of day because we're physically here 24 hours a day, 7 days a week. It's very helpful that they can say, I want to speak with the doctor, and then the doctor's available. We also have a relationship with all the referring pediatricians, which are the patient's primary care physicians. So it's really important that we inform their primary care physicians, number one, because they're very bonded with their patients and they're very involved and they want to know what's going on. So that's really important. Number two, we understand that for the patients, it's really important sometimes that they're aware that their physician agrees with our plan, because we know that they're only seeing us when their child is sick and they don't have this pre-existing relationship. So it's important that their physician is aware so that they can support the same plan and so that we're all on the same page. If the patient needs to go to the ICU, whether they're on our pediatric inpatient unit and their condition is getting to the point where they need to go to the ICU, or they arrive in the emergency room and they really require ICU level care, we can coordinate that transfer very easily. And then as far as the outpatient benefit, we have very strong ties with the subspecialists and we work with them on a regular basis. So when a patient is in the community and needs outpatient care from a pediatric subspecialist, the floating is quite accessible, but if there's any problems, we're always available to help coordinate that care and get the patient the care that they need.